Hey everybody, tonight I am going to be joined by Mike Berkeley from the Berkeley Center in New York, United States, and we're going to be talking about Chinese medicine, so fertility herbs and acupuncture for fertility. He's there, so I'm going to let him in now. He's just written a brilliant article for us with Fertility Help Hub website, which just came out yesterday, so you must go and read it. We have something exciting to talk about afterwards. Evening, Mike, or should I say afternoon? You turn the camera. There we go.
I'll say good evening to you, and
Yep.
it is afternoon here. Can you see me okay on this thing?
Perfect. Hello,
Okay.
thanks for joining. We've got Mike for now, which is wonderful, who will be happy to ask your questions. Just as you were joining, I was explaining that you have written a brilliant article, which went live on Fertility Help Hub's website yesterday, all about the benefits of using Chinese medicine to complement natural conception and also assisted reproduction. So head to fertilityhelphub.com to read that in depth, but let's pull out some of the key things that you discussed in that article. So do you want to introduce yourself and your center a bit, and then we'll jump into how these things can help?
Absolutely. Just trying to get some light on. Is that better?
That's better. Yeah, great.
Okay, good. So hi, everybody. I'm thrilled to be here. And Eloise, thank you so much for having me on. My name is Mike Berkeley, and I'm the founder and director of the Berkeley Center for Reproductive Wellness in New York City. I'm a licensed and board certified acupuncturist and a board certified herbalist, and I've been specializing in the treatment of infertility cases for 23 years. In fact, I'm the first practitioner in the United States to devote a clinic strictly to the care and treatment of those faced with fertility challenges.
Amazing.
So that's all I've been doing. It's all that I do, and I love doing it, and I'm thrilled to be here.
Great. And so what are the kind of patients that you see? I mean, obviously the last few months have been difficult, having been shut, and I know you're doing things virtually, and we'll discuss that in a minute, but typically who would you see, and how can you help?
So I see basically every kind of patient with every kind of pathology except physical pathology. So if a woman,
Mike, someone's saying the screen is frozen. Is that my screen or is that Mike's screen? Because we may have to log out and log back in if that's the case. It looks fine my end, but I have had this before. So if someone could please just write and tell us whose screen is frozen and whether it's working now, that would be amazing. Can't see anything yet. Nothing is frozen for me. Okay, sorry, carry on.
No, it's fine. Maybe it was frozen for a second or something.
Okay, cool.
Okay. So I treat patients with polycystic ovarian syndrome. Mm-hmm. I treat patients with endometriosis. That's a long story because I treat patients with endometriosis after they've had a laparoscopy, but there's more to that story. I treat men for male factor issues, and I think probably the largest population of patients that I have these days are not necessarily patients with pathology, but patients who fall within the aegis of advanced maternal age, meaning above 35 years old. So the pathology, if you will, in that case, for lack of a better term, is the fact that many women over 35 years old have two concomitant issues. One is diminished ovarian reserve, and one is poor egg quality. And of course, acupuncture and herbal medicine, and this is a very important thing for the listeners to be aware of, no matter what anybody says, acupuncture and herbal medicine cannot give you more eggs.
Yeah.
A woman is born with all the eggs she's ever going to have. She loses 1,001 eggs every month. 1,000 die, one is ovulated. And so acupuncture and herbs are not of benefit to give one more eggs, but it is a great benefit to improve egg quality and or lining quality.
And can you explain a bit more about how acupuncture and herbs do that? Is it through blood circulation, blood flow?
Yeah, yes, indeed. Another very good question. So I'm going to start by saying this. If a man has, or even if a woman has very skinny arms and skinny legs and not in great shape, can they get in great shape? Yes, of course. They have to change their diet and go to the gym 3 or 4 times a week and get a personal trainer. If somebody's eyesight is not very good, what do? They get a prescription and they get these. If their hearing is not very good, they can get a hearing aid. If they have arterial sclerosis of the coronary artery, they can get coronary bypass surgery. So it seems to me that every single thing in the body almost is reparable, is improvable. So why not can egg quality be improved upon? In my estimation, based on 23 years of practice and reading literature that's several thousand years old, I'm convinced that it can help egg quality. So in answer to your question, here's how it works. So acupuncture, there's no medicine on the needles. They're just plain stainless steel needles. But when you insert these needles in certain parts of the body, they improve and increase hemodynamics, which means blood flow, essentially, which is what you said. Now, why is that important? Well, FSH and LH is produced where? It's produced in the anterior pituitary gland, which is in the brain. How does the FSH and LH get from the brain all the way down here to the ovaries? Through the blood. How is the endometrium, the uterine lining, how is the health of the lining facilitated? Through blood flow to the lining. So as people get older, as women get older, as men get older as well, the blood circulation becomes a little less patent than it was when we were 25 years old and we were exercising and we were going out all the time and we had a more active life. And so as one gets older, one can use this contribution to the circulation to direct the flow of blood to the ovaries. Specifically, the blood is carrying oxygen, nutrients, hormones, and electrolytes to the ovaries and the uterine lining. And simultaneously, the blood is like a taxi cab. So it delivers all this stuff to the destination, but it doesn't come back with no passengers. It comes back with what is called debris, which means dead cells. And as most people are aware, and if anybody listening is not aware, now you will be, every second we are losing tens of thousands or hundreds of thousands of cells. They die every second, and then the body produces new cells. What happens to the dead cells? Well, they get excreted from the body in a multitude of ways, either defecation, urination, exhalation, or sweat, or perhaps through the metabolic function of the liver. And so by stimulating blood flow to the ovaries, you're delivering all this good stuff, which will help improve egg quality, and you're helping to excrete, to facilitate a higher level of excretion of dead cells from the ovarian milieu. So you're creating an environment where the developing oocytes, the eggs, are now getting, if you can think of a garden, they're now getting more sunshine and more rain than they were heretofore. Now, I'm just going to stay with this for one quick second, because people inevitably are going to either think this or say this, and I want to address it. So people are going to think, well, Mike, that's all well and good, but I have a heart, and my heart is beating, and my heart is stimulating blood flow to the ovaries. So why do I need acupuncture? So that's a very good point. And the heart is beating, but just like your muscles are getting healthy from the food that you eat, but they don't build and develop unless you do a lot of push-ups every day. So even though the heart is stimulating blood flow all over the body, including the ovaries, as one gets older, one can use some assistance in facilitating blood flow to the ovaries and the lining. And of course, why the lining? Because there are many cases of implantation failure because of a bad lining. And speaking about the lining very quickly, morphology is not analogous to endometrial vascularization. And what that means in English is that when the doctor does a transvaginal ultrasound and he says, oh, you have a beautiful 10 millimeter lining, that's just what we want. And the embryo is transferred, I'm just talking about IVF procedures, the embryo is transferred. It's a grade A embryo. It's a beautiful blastocyst, no fragmentation. It's beautiful. It's completely chromosomally normal, and you transfer it and it doesn't work. Why not? It's a 10 millimeter lining. It's beautiful because even though morphologically it's 10 millimeters in thickness, it does not mean that it's a healthy lining. Mm-hmm. So that's the mechanism of action of acupuncture. Now, herbal medicine is a little bit different. So first of all, patients come in twice a week for acupuncture, but they're taking herbal medicine twice a day, every day, 7 days per week. So essentially, they're getting treated 7 days a week with herbs, 2 days a week with acupuncture. The herbs are internal medicine. They're working from the inside out. Acupuncturists work from the outside in. Let me give you an example. If any of the listeners here have a splitting headache, and you say to your partner, "Hun, please give me a massage on my shoulders and on my neck and on my head. I have a splitting headache." And their partner says, "Of course, no problem." And they start to massage this individual. The person with the headache will start to feel better at some point. But what would happen if that patient took 3 Advil or 3 aspirin and then their partner started to massage them? They would get better faster. So that analogy is showing, the effect of combining internal medicine, the aspirin, and external facilitation of health through the massage. And so with acupuncture and herbs, it's a similar thing.
Okay. And would you say that that's the kind of combination as well with Western medicine and Chinese medicine?
So that's another fantastic question. I think I understand the question. I'm going to run with it, but if I'm going in the wrong direction, let me know. So here's the thing about IVF. The first thing I want to say is I fully support in vitro fertilization. There are acupuncturists who don't embrace Western medicine. They're all foolish because without Western medicine, we'd all be dead. And as a result of IVF, there have been more than 4 million babies born. However, the question remains, how many transfers were done to get the 4 million babies? Now, I don't know the answer. It's a rhetorical question. But perhaps there were 15 million transfers done, and 4 million women gave birth. And so IVF is an effective method of intervention for somebody faced with fertility challenges. But remember what IVF is. It's strictly a mechanical device. You give a patient gonadotropins to stimulate the development of follicles. You retrieve the follicles, mix them with the sperm, get an embryo now. You have an embryo now, and you transfer the embryo into the uterus, and everybody keeps their fingers crossed and prays for a good outcome. What's the problem with this picture? The problem is the reproductive endocrinologist is using what he or she has available, and that means his sperm and her eggs. And if her eggs are not great and his sperm is not great, it doesn't mean that they can't get an embryo. They can and they will get an embryo. But what is the integrity of the embryo? Does it have enough integrity to manifest not only a pregnancy, but a live birth? So the answer to that question is sometimes it does and sometimes it doesn't. So from my point of view, I believe that East meets West in reproductive medicine should be the new gold standard and probably eventually will be. And so in answer to your question in a more direct way, I believe that integrating acupuncture and herbal medicine with Western medicine is the way to go. Because what I can do for the patient, the reproductive endocrinologist cannot do. I can improve your egg quality and your lining quality and your sperm quality. The reproductive endocrinologist cannot. However, I cannot do a retrieval or a transfer. So combining the two will yield better results.
Absolutely. That's very well answered. Thank you. We've had quite a few questions, so I'm going to fire them at you now.
Please.
If the people are still on there, just bear with me whilst I find them. Okay. First one. Can acupuncture help irregular periods?
So it depends on why. a woman has irregular periods. I'll go through a couple of scenarios. The first thing that comes to mind is the patient that has polycystic ovarian syndrome. So in that patient, let's just put it this way, many patients with polycystic ovarian syndrome have irregular periods. So acupuncture and herbal medicine can be very beneficial to the PCOS patient, not only for the regulation of the period, which is an excellent thing to try to attempt, because if one can do that, that patient may not need assisted reproductive, a Western assisted reproductive technology. She may be able to get pregnant on her own. Now, the other thing about PCOS patients, if anybody's listening who has PCOS, and don't be frightened by this, because many hundreds of thousands of PCOS patients have babies, but I want to give you the information. The PCOS patient is twice as likely to miscarry as the non-PCOS patient. And the reason for that is because that patient has too much androgen in the follicle. And androgen at that level essentially is an anti-estrogen, so it yields poor egg quality. So I think the answer is not all the time, but many times acupuncture and herbal medicine can regulate the period in a polycystic ovarian syndrome patient. Now that's a good outcome. Let's talk about an outcome that might not be so good. So there's a woman who gets her period every 2 months, then it's every 3 months, then it's twice in 1 month. Then she hasn't had a period in 2 months, and it doesn't matter her age. She could be 25 years old. But what's going on with this woman? She's in premature ovarian failure, and in that case, acupuncture and herbal medicine can't do anything, because we can't work. I can't work when something is not there. My job is to help improve the egg quality in this particular case. But if a woman literally has, 300 eggs left,
you can't, yeah.
She's in premature ovarian failure. So in that case, I'm not too confident. I think that's strictly a donor egg case.
Okay, thank you for your honesty.
Yeah, of course.
And for the people who have asked these questions, if you've got any further questions from Mike's responses, then please let us know. Next one, how can you test that egg quality has been improved? Can you test that or find that out?
So an excellent question. It's literally impossible to test egg quality. There is no technology available anywhere on the planet that can test egg quality. What can be tested, but not really, it can be tested, but it's not going to be tested today as well as it's going to be tested in 5 years. And what that is the embryo. So an embryo can be tested. How do they test the embryo? They take, this is from a day 5 embryo, which is called the blastocyst. They take a couple of cells from what's called the trophectoderm, which is the outer layer of the embryo, and they can tell if it's euploidic or aneuploidic. So aneuploidic means it's chromosomally abnormal. Euploidic means it's a chromosomally normal embryo. But listen, there are so many occasions when a patient will have a euploidic embryo, a good embryo, and the embryo will be transferred and she won't become pregnant. So what's the moral of the story? The moral of the story is that embryos can be tested based on the current available technology, but the current available technology is not as good as it's going to be in 5 years from now. So even testing of embryos is still a partial science. It's not an exact science. But to answer the question directly, you cannot tell the quality of eggs. The only way to really test the quality of an egg is having a live birth.
Okay.
Then you know you had a good egg. That's the only real test.
Okay. What are your thoughts on tapping? And that's something I didn't know the name of, but apparently it means using fingertips for pressure points at home.
Okay, so I must confess that I'm not familiar with this, and that may sound odd to many of the listeners, but I'll try to explain it briefly. I'm a classical practitioner of acupuncture and herbal medicine, so I've spent many years studying the old ways, the ways that the foundation of this medicine.
Yeah.
So I'm not sure of tapping, but there's something we call it in the States, or acupressure.
Right.
Where you can just follow, if you can see this, just like pushing on this point here. That's acupressure. So, I suppose that there's some benefit to it. I would much prefer, Listen, if you have a chronic stomach ache, chronic, and you rub your tummy, it's going to make your tummy feel better, but it's not going to really diagnose or treat the fact that you might have an ulcer. So real treatment is better than pseudo treatment. So I think acupressure may be good for certain things. It's good for a headache. It's good if your leg hurts. I'm not too confident in it in the context of fertility enhancement.
Great answer. Thank you.
Thank you.
This is a really good question. When someone's looking for acupuncturist, do they need for fertility? Do they need to look for one who specialises in reproductive assistance, or is this a common?
Okay, so you actually froze for a minute, but I heard the whole question.
I know.
Welcome
I
back.
think it was my phone battery. I don't know why. Sorry. Hang on. There we go.
No.
Sorry,
Do you know what's amazing, really? What's amazing is that you're in the UK and I'm in New York City, and we're having this conversation. So,
yeah.
you know, I'm a big fan of technology.
I know. It's great.
So, oh, I got the question.
Did you get
yes,
the question?
Yes, indeed. So it's yeah, yes, indeed, totally. So the answer is, one should absolutely, positively try to find a specialist in the world of fertility knowledge and treatment and focus. Let's just use a Western medicine analogy or a Western medical analogy. A gynecologist, right? I mean, a gynecologist is involved in women's health. You wouldn't have your gynecologist do an in vitro fertilization. Now, forget the fact that the gynecologist isn't licensed to do it.
Yeah.
But let's just make believe in a world of fantasy that the gynecologist was allowed to do it. The gynecologist is very knowledgeable, but doesn't have 1/10 of the knowledge of a reproductive endocrinologist in the context of fertility challenges.
Yeah.
So it's the same thing with an acupuncturist. If you go to an acupuncturist that spent the last 10 years treating neck pain and back pain, you know, that acupuncturist is going to, well, I shouldn't say that. If the acupuncturist takes on the case, number one, I don't think that's an ethical way to behave. And I think that the patient should seek out a practitioner who specializes in fertility. I don't know this woman personally, but I'm going to mention her name to your audience. And as incredible as it sounds, and I feel terrible about it, I'm not a huge traveler. I've not been to the UK, but it's on my list for my next once this COVID settles down.
Yeah.
I'm going to come over. But I have known about a woman in London who's quite renowned as an acupuncturist for fertility. Her name is Zita, Z-I-T-A, West.
Yeah.
So that's a good lead that I can give your practitioners. If you're in London, again, I don't know anything about the geography of the UK. So if you're far away from London, at least you can get in touch with Zita West and say, hey, look, I'm in the East End. I'm just making that up, right? Do you know anybody over here that specializes in acupuncture and herbs for fertility?
Yeah, so I know quite a lot of people in the UK who do, in London as well, who do specialize in it. So if you want any recommendations, please don't hesitate to ask. And I met Mike in New York, and you are renowned in the field, hence wanting to set up this call. Someone has just said, thank you so much. This is really, really cool to watch.
Thank you for watching, and it was my pleasure.
Next question. I'm going to try and fire through these. Can acupuncture help increase the blood flow during a period? This lady has got light periods and trying to conceive and worried about her lining. She's trying to conceive naturally at the moment.
So it's a very complicated question. It's a great question with a complicated answer. It's a complicated scenario. So the reason that this woman has a thin lining and a little bit of bleeding, well, obviously, the thicker the lining, the greater the bleed. So why does she have a thin lining? There are one of two reasons. One reason is she's over 38 years old and she's taken clomiphene citrate 3 months in a row, and that's thinned her lining. That's probably not the case, but that can happen. Probably what the case is this woman has very low ovarian reserve. What does low ovarian reserve have to do with the lining? So I'll try to do this quickly and succinctly. So there's a structure that houses the egg. It's called the follicle. The follicle secretes estrogen. Estrogen is what thickens the lining. After a woman ovulates, the follicle is no longer the follicle. It's now the corpus luteum.
Mm-hmm.
And the corpus luteum secretes two things, estrogen and progesterone. So the more follicles a woman has, the more estrogen and progesterone she has. And certainly in the beginning of the, before ovulation, the most important hormone for thickening the lining is estrogen. But because she's in low ovarian reserve, she doesn't have a lot of follicles. Therefore, she doesn't have a lot of estrogen. So she's not going to have a thick lining, nor will she have a heavy bleed or even a normal bleed. So alas, acupuncture and herbs will not help this woman, because this is a case that the primary root of the case is diminished ovarian reserve, and acupuncture and herbs cannot give you more eggs. So what I'm going to say to this woman, if she's still on and listening, is you can thicken your lining under the care of a reproductive endocrinologist by wearing an estrogen patch, or an estrase patch, and that will thicken the lining. And then if you have very low ovarian reserve, you can try to do a mini IVF, which is to say very low levels of gonadotropins, not lots and lots of medicine. If you take lots and lots of medicine, you're not going to produce any more eggs than if you take a little bit of medicine. And taking lots and lots of medicine will tax your ovaries. It will overwork your ovaries. So use a low dose amount of gonadotropins, prep the lining with estrase, and then see what happens. Do this 2 or 3 times. God willing, it'll work. If it doesn't work, unfortunately, it's a donor egg case.
Okay, thank you. On that note, actually, I was speaking with a professor recently about the sort of mini IVF. So if that lady is still watching and lives in the UK and looking for help, feel free to message you and I can put you in contact with her. Someone has said that they have a borderline underactive thyroid and also have PCOS with irregular periods. So what would your advice for them be, please?
Well, the first thing to do, which is of paramount importance, is to have your thyroid fixed with medicine. So I'm not sure what the medicine is used over there. In the States, we use 2 different types of medicines. One is called Synthroid and one is called levothyroxine. So if you have hypothyroidism, you need to take one of these medicines, or the equivalent medicine that you guys have over there. The thyroid is very instrumental in pregnancy, and if the thyroid is off, when a woman's pregnant, she can have what's called a thyroid storm. It can wreak terrible havoc on the woman and the baby, and it's so unbelievably easy to correct. You take 1 pill a day, there's no side effects, and you're totally fine. Okay. So number 1 is fix the thyroid. And then number 2, if you have polycystic ovarian syndrome, I think that acupuncture and herbal medicine can be of benefit to this patient. And I always say can be. I'm not going to overstate my boundaries. I mean, let's talk about IVF. Yeah. IVF can be the winning number, but it may not be. So I think acupuncture and herbs hold an upside potential and no downside potential. So where it's realistic to use, for example, it's not realistic to use it in that woman, unfortunately, who's got, quite serious low ovarian reserve, don't use it. But in the polycystic ovarian syndrome patient, absolutely you should use acupuncture and herbs in conjunction with Western medicine.
Brilliant. Thank you so much, Mike. That's led me on to something that I want to speak to you about in a minute when we've just covered these questions, but I don't want to not cover these questions for people who are watching. So this is a really good one and something I asked a lot when I was trying to conceive. How often would you need acupuncture for fertility?
So another really good question. And I hate to be long-winded, but all these questions, kind of elicit so much.
I know.
So here's how acupuncture works in China. Patients get treated 5 days a week for maybe 3 or 4 weeks at a time, and they stop and see what the results are. If the results are not forthcoming, they'll do 5 days a week for another 3 or 4 weeks at a time, and that's how they do it over there. Typically in the United States, acupuncturists see patients once a week. I think that's a very bad move. I treat all of my patients twice a week. Let me explain why. If somebody's very psychologically, emotionally depressed, seriously depressed, you're not going to go to therapy once a week. You're going to go to therapy twice a week, maybe 3 times a week. If you want to get in great beast shape, you're not going to go to the gym once a week. You're going to the gym 3 to 5 times a week. If you're, God forbid, in a car accident and you've busted your shoulder up and you need to go to physical therapy, I can assure you that you're not going to go to physical therapy once a week. You're going to go to therapy 5 times a week, and then 4 times a week, and then 3 times a week. So I treat patients twice a week until they're, this is my own protocol. I treat twice a week until they're pregnant. And once they're pregnant, I treat twice a week for 13 weeks. Why 13 weeks? Because 90% of miscarriages occur within the first 12 weeks. So my job is twofold. It's to try to help this patient conceive, and then to try to help the patient to not miscarry.
Mm-hmm. I carried on having acupuncture when I was pregnant after IVF for that reason.
Right. Yeah, good move.
And should you always pair acupuncture with Chinese herbs and supplements for a better outcome?
So, so that's a really well-crafted question. So I'm going to answer it in 2 ways. The answer is yes, 100%, absolutely no questions asked. That's the first answer. Okay. The second answer is a lot of reproductive endocrinologists don't want their patients taking herbs when the patient is taking gonadotropins. Right. So let me just touch on that for a second. I would never personally give a patient or insist on it or twist their arm or try to motivate them to take herbs if their RE, the reproductive endocrinologist, said not to. But what the people here listening must understand is that there's no downside to it whatsoever, at all. The reason the reproductive endocrinologist doesn't want you to take herbs when you're taking gonadotropins is because they're trying to protect you. How are they trying to protect you? They don't know anything about herbs. They went to Western medical school or School of Western Medicine. So they're afraid of you taking herbs because they think it could either increase the effect of the gonadotropins or decrease them. It does neither. If you have the time, either before your first cycle or in between cycles, yes, do the herbs with the acupuncture. And if you're with a board-certified herbalist who specializes in fertility, ask your reproductive endocrinologist. Say, listen, doctor, I've done 3 IUIs and 2 IVFs, and they've all failed. I'm going to do another IVF with you, but I'd like to take herbs with the gonadotropins. What do you think? Okay, that's a great answer. This actually leads me on to the next question from Jamin1121. Now, is there a resource to find a reproductive acupuncturist in a specific area in the US? I would ask where they are. This person's done lots of Googling with no luck. Mike does things remotely. Can you tell people what you're able to do remotely and what you need to do in person? Yes, but I'm sorry. Did you ask if there's a compendium of information in the States for acupuncturists who specialize in fertility cases? To find one, is there like a directory of reproductive acupuncturists in the US? I don't, absolutely. So it's for the United States at this point and Canada. Hopefully this group, we have some people, there are some acupuncturists that are involved in this organization in Ireland. It's gonna end up going all over the world. But the name of the organization is A as in Apple. This is a website. It's a web address. A as in Apple, B as in boy, O, R as in Robert, M as in Mike, ABORM.org. Perfect. And this organization is the American Board of Oriental Reproductive Medicine. And everybody on that site actually had to sit for a test and become certified by this organization. Let me just tell you a really quick story. Mm-hmm. So I was in the first cohort of people to go and sit for the test. And of course, I didn't study for 5 minutes because why do I need to study? You know, I know all this stuff. So I went and I sat down, and it was a darn challenging test. And I was like, man, the test is a very, very serious test. It's not just like, what is FSH? You know, it's a so anybody on that board is a legitimate qualified individual. Okay, great. Thank you. You have just answered. How many questions did we just get? I don't know, 15? Thank you so much, Mike. Of course, my pleasure. And
the thing I wanted to say to people who are going to watch this back and those who are online now, Mike is kindly offering 10% off to Fertility Help Hub readers. So if you would like a consult with him with 10% off, then you can either message me and I can introduce you, or you can message him directly through the account that Mike has joined on, the Berkeley Center. So thank you so much. Is there anything you wanted to add at the end, Mike?
Yes, there is something I want to end. Don't you know I never stop talking?
Go for it.
What I really want to say is two things.
Mm-hmm.
I want to thank the listeners and the participants because it gives me tremendous joy and pleasure to be able to help another human being. And if I've even helped one person on this chat, that makes my month. It gives me tremendous gratification and fills me with light and love and warmth. So you've done me a favor. So I want to
love
say
the
that.
passion. I love the passion that you bring, and all of those
you.
messages above say that it's been hugely beneficial. So thank you.
Thank you. And Eloise, I have something to say to you.
Okay.
I want to say that you are a true mover and shaker in the world of fertility challenges. You're doing big things, important things. I so respect and admire you. And finally, I want to thank you for setting this up and for giving me this wonderful opportunity.
You're so welcome. And I really hope it's benefited people today. So thanks again, Mike. And
thank you.
Please head to the Fertility Help Hub website, link in bio, to read Mike's article that he's written all about everything we've been discussing today in full detail, and why people might be scared of taking herbs, etc., and the benefits of it and how it should be done. So head to the website, check it out, and I'll be promoting that tomorrow. So thanks so much, Mike.
Bye, everybody.
Okay.
Thank you. Have a great
Bye.
evening. Bye-bye.
Bye.